So, good noon, students. Today's topic for discussion is a paranasal air sinuses. So, these paranasal air sinuses are air-filled spaces inside the skull bones related to the nasal cavity. Okay, so you have four pairs. Okay, so these are named according to the situation of the sinuses. Okay, so these are frontal, related to frontal bone, ethmoidal, sphenoidal, and maxillary sinuses. So these sinuses are named in relation to the situation. So where it is situated and which bone they are situated. So we'll see one by one. So we'll see these paranasal sinuses, where it is situated, what are the boundaries of these paranasal air sinuses, and then supply. So before going to that, we will see what is the function of this paranasal air sinuses. Okay, so it humidifies and warms the inspired air. So that is the foremost function. So, and it adds resonance to voice also, and it reduces the weight of the skull. So that's why we feel heaviness in the head after a common cold, in which these sinuses are commonly inflamed. And then these sinuses are filled during expiration. So after the air enters these air sinuses, the air is warmed and humidified, and it enters the nasopharynx during inspiration. Okay, so the function of this air sinus is it humidifies and warms the inspired air, it adds resonance to the voice, and it reduces the weight of the skull. So coming to the first sinus, that is the frontal sinus. So where it is situated? So it is situated between the inner and the outer tables of the frontal bone. Okay, so it is situated between the inner and the outer table of the frontal bone. So this picture, this is the CT picture, which give you the idea of the situation of the frontal sinus. So it is situated between the inner and the outer table of frontal bone. So and it is situated above and deep to the supraorbital margin. So above and deep to the supraorbital margin. So coming to the boundaries of this, so it has an anterior wall, posterior wall, and a inferior wall. So this is the anterior wall of the frontal sinus, which is thick, and it is related to the skin of the forehead. Okay, so this is a posterior wall, which is thin, and it is related to the meninges and the frontal lobe. So this is the inferior wall, which is formed by the roof of the orbit. The inferior wall of the frontal sinus is formed by the roof of the orbit. Okay, so the frontal sinus is situated between the inner and the outer tables of the frontal bone, and it's situated above and deep to the supraorbital margin. And these right and left frontal sinus are often asymmetrical. Okay, so it coming to the boundaries, so it has an anterior wall, posterior wall, and a inferior wall. Anterior wall is thick, and it is related to the skin of the forehead. The posterior wall is thin, and it's related to the meninges and the frontal lobe of brain. The inferior wall is formed by the roof of the orbit. Okay, so that's about the boundaries of the frontal sinus. So coming to the nerve supply, so this frontal sinus is innervated by the supraorbital nerve, which is a branch of the frontal nerve. So supraorbital nerve innervates this frontal air sinus. So when it is inflamed, the inflammation of this sinus is called as sinusitis, and this frontal sinusitis is given the special name as this office headache. So the inflammation of the frontal sinus is called as produces headache, and that headache is specifically called as office headache. Okay, so this is the sagittal section of the head and neck CT picture to show you the situation of this frontal air sinus and also the sphenoidal air sinus. So on coming to this, so this is the coronal view, coronal section of this head and neck. The CT picture, this is also the CT picture, to show the paranasal air sinuses and the nasal septum. Yes, so this is the orbit, two orbits, and this is the nasal septum in the midline. Yes, the nasal septum forms the medial wall of the lateral nasal cavity, and these are the concha. This is the inferior concha. So the space is the meatus, middle concha, and the superior concha you have there. And this is the maxillary air sinus, and that is the frontal air sinus situated there. Okay. Okay. So this frontal air sinus, it drains into the anterior end of the infundibulum of middle meatus via the frontonasal duct. Okay, so this frontal air sinus is drained by the frontonasal duct, which begins in the opening of the sinus, that is in the floor of the nasal floor of the frontal sinus, and it opens into the anterior end of the infundibulum of middle meatus. So actually this is the anterior end of infundibulum of middle meatus, that is the opening of this or drainage of this frontal air sinus. Okay, so this frontal air sinus drains into the anterior end of infundibulum of middle meatus via the frontonasal duct. So that is the drainage of this frontal air sinus. Okay, so the frontal air sinus is situated between the frontal air sinus is situated between the outer and the inner tables of the frontal bone, and the boundaries of this frontal air sinus are the anterior wall, posterior wall, and the inferior wall. So the anterior wall is thick, which is related to skin of the forehead. The posterior wall is thin, it's related to meninges and the frontal lobe. The inferior wall is formed by the roof of the orbit. It is innervated by the supraorbital nerve, which is a branch of the frontal nerve, and this inflammation of the frontal sinus, you call it as office, and the headache produced by this is given a special name as office headache. Okay. So it is drained by a frontonasal duct, which begins in the opening of the sinus. It is located in the floor of the sinus, and it drains into the anterior end of infundibulum of middle meatus, which is in the lateral wall of the nasal cavity. Okay, so coming to the next sinus, that is the ethmoidal air sinus. So actually this ethmoidal air sinus, these are thin walled air cells. So these are thin walled air cells that is situated in the labyrinth of the ethmoid bone. So that is the situation of this ethmoidal air sinus, that is the thin walled air cells that is situated in the labyrinth of ethmoid bone. So coming to the boundaries of this ethmoidal sinus, so the roof is formed by the meninges of the anterior cranial fossa. The lateral wall is formed by the lamina papyracea. So lamina papyracea, that is a part of the ethmoid bone, that is extremely fragile bone. So any slight injury to this lateral wall of ethmoidal sinus, which leads to the spread of infection to the orbit. So that's about the boundaries. So this ethmoidal sinus is composed of thin walled air cells, the small air cells in the labyrinth of the situated in the labyrinth of the ethmoid bone, and the boundaries are the roof, which is formed by the meninges of the anterior cranial fossa. The lateral wall is formed by the lamina papyracea, so which is extremely fragile, and even slight injury to this wall will leads to the spread of infection from this ethmoidal sinus into the orbit. So you have three groups in the ethmoid air sinus. So you have anterior, middle, and posterior. So this each drains via different path in the different paths in the different areas in the lateral wall. Okay, so this posterior ethmoidal air sinus drains into superior meatus. Yes, this posterior ethmoidal air cells drain into the superior meatus, whereas the middle drains into the bulla ethmodalis. So you have this, I think you remember the middle meatus, you have an elevation produced in the middle meatus that you call it as bulla ethmodalis. That elevation is produced by this middle ethmodal air cell, and it drains into that elevation. Okay, then where that is anterior ethmoidal air cell drains, it drains into the anterior end of the infundibulum. So this part is the anterior end of the infundibulum. So here it drains the anterior ethmoidal air sinus. So just above the anterior ethmoidal air sinus, opening of the anterior ethmoidal sinus, you have the location of the frontonasal duct through which the frontal air sinus drain. Okay, so that's about the drainage of this ethmoidal air cells. So the nerve supply of this is by the ethmoidal nerves. Okay, so the nerve supply is by the ethmoidal nerves. Okay, so this ethmoidal sinus is situated, is nothing but a thin walled air cells which is located in the labyrinth of the ethmoid bone. The boundaries are the roof, which is formed by the meninges of the anterior cranial fossa. Lateral wall is formed by the lamina papyracea, which is a fragile one, and you have three groups: anterior, middle and posterior. So the anterior drains into the anterior end of infundibulum of middle meatus, whereas the middle drains into bulla ethmoidalis with the middle meatus, whereas the posterior drains into the superior meatus. So the nerve supplies by the ethmoidal nerves, which are branches of nasociliary, and the orbital branches of maxillary nerve to supply this ethmoidal air cells. So this picture, 3D picture, will give you an idea of the location of these sinuses. So this one is a frontal air sinus. Yes, so this is a frontal air sinus, and this is the ethmoidal air cells. Okay, ethmoidal air cells. You have three groups. Yes, anterior, middle, and posterior, and these three drain into different areas. And this is the red color at the back is the sphenoidal air sinus, and here this light green structure is the maxillary air sinus. So coming to the next one, that is the sphenoidal air sinus. Sphenoidal air sinus. So where it is situated? It is situated in the body of the sphenoid. So it is situated in the body of the sphenoid. And the boundaries of this anterior sphenoidal air sinus is the optic chiasma. Sorry, there's spelling mistakes in the chiasma. The optic chiasma forms the anterior part of the roof. The posterior part of the roof, so this is the section to show the cavernous sinus and its relation. Yes, so I hope you remember this cavernous sinus. That's a very important theory question for you. So this cavernous sinus, the medial wall is related to the pituitary gland above, sphenoidal air sinus below. So this sphenoidal air sinus is related to the cavernous sinus, and these cranial nerves, yes, the oculomotor, trochlea, abducent, and all the three divisions of the this ophthalmic, maxillary, and mandibular divisions of the trigeminal nerve, and also to the internal carotid artery laterally. So on the roof is formed by this optic chiasma in the upper part, and the pituitary gland in the lower part. So this picture will give you the clear idea of the relations of the sphenoidal air sinus. So the sphenoidal air sinus is situated in the body of the sphenoid. Is situated in the body of the sphenoid. So the boundaries are, so the roof, the anterior part is formed by the optic chiasma, the posterior part is formed related to the pituitary gland, and in the lateral wall is related to the cavernous sinus, internal carotid artery, and the cranial nerves, which I described you earlier. Okay. So nerve supply. So this sphenoidal air sinus is innervated by the posterior ethmoidal nerves and the orbital branches of maxillary nerve. So an important thing here is the regarding this sphenoidal air sinuses. Since the pituitary gland is related to this related to the roof of the sphenoidal air sinus, so the pituitary gland can be easily approached through this sinus. So that you call it as transsphenoidal approach. Okay, so that through this sphenoidal air sinus, the pituitary gland can be approached endoscopically, and this surgery is a transsphenoidal approach that is used to remove the pituitary tumor. Yes, this CT picture, that is the sagittal section, will again tell you the situation of this sphenoidal air sinus. So this is situated in the body of, this is the body of the sphenoid where the sphenoidal air sinus is situated, and this is the roof. So the anterior part of the roof is related to the optic chiasma, the posterior part of the roof is related to the pituitary gland, and this lateral wall is related to the cavernous sinus, internal carotid artery, and the cranial nerves. So it is oculomotor, trochlea, the three divisions of the trigeminal, and the abducent. So the sagittal sections, and these sections will help you to understand the anatomy better. So the relations of these and all. So coming to the largest sinus, that is the maxillary air sinus. So the other name for this sinus is the antrum of Highmore. It is the largest of all the four sinuses. So its capacity of about 15 ml in adult. So it is situated in the body of the maxilla, and it is pyramidal in shape with the base directed towards the lateral wall of the nasal cavity and the apex pointing towards the zygomatic bone. Okay, so this picture, so it is pyramidal in shape. Yes, so this is pyramidal in shape roughly. So this is the apex which is directed towards the zygoma, and this is the base of this maxillary air sinus. Okay, so that is the maxillary air sinus is the largest of all the three sinuses. It is otherwise called antrum of Highmore. Its about capacity is about 15 ml in adults, and it is pyramidal in shape, and it is yes, it is pyramidal in shape, and its base is directed towards the lateral wall of the nasal cavity, and its apex is pointing towards the zygomatic bone. Okay, so coming to the boundaries of this maxillary air sinus. Yes, so we have this anterior wall, a posterior wall, a roof, and a floor, along with the medial wall. So we have anterior wall, posterior wall, medial wall, roof, and the floor. So the anterior wall is formed by the maxilla. Yes, so this is this picture. So this is the coronal section on the left side, and this is the sagittal section on the right side. So this anterior wall is formed by the maxilla. Yes, so this is the anterior wall which is formed by the maxilla, and then you have this is the inferior wall. Yes, so this is the inferior wall. So this is again, these are the alveolar process. Yes, I think you remember the alveolar process provide the sockets for this attachment of the tooth. The tooth is lodged there. So the inferior wall is formed by the alveolar process of the alveolar and palatine process of the maxilla. Sorry. And then you have this anterior wall, this posterior wall, which is formed by, which is related to the infratemporal and the pterygopalatine fossa. The medial wall is related to the lateral wall of the nasal cavity. Okay, so you have the anterior wall, you have the roof. So the roof is formed by the floor of the orbit, and the floor is formed by the alveolar floor or the inferior wall, that is formed by the alveolar and the palatine process of maxilla. The medial wall is formed by the lateral wall of nasal cavity. The posterior wall is formed by the infratemporal and the pterygopalatine fossa. Okay, so these are the boundaries of maxillary air sinus. Okay, so once again I tell you, so this is the anterior wall which is formed by the maxilla. This is the inferior wall or the floor which is formed by the alveolar and the palatine process of maxilla. This is the superior wall or the roof, which is formed by the floor of the orbit. The posterior wall is related to the pterygopalatine and pterygopalatine fossa and infratemporal fossa. So this you have this medial wall. The medial wall is related to the lateral wall of the nasal cavity. Okay, lateral wall of the nasal cavity. Here this lateral wall is related to the zygomatic bone. So that's about the boundaries of maxillary air sinus. Okay, so coming to the blood supply. So blood supply is the nutrition of this sinus is taken over by this infraorbital artery, which is a branch of this maxillary artery in the roof. And then here in the posterior wall you have the posterior superior alveolar artery, which is again a branch from the maxillary artery. Is related to the posterior wall, and the middle superior alveolar artery is in the via the anterior wall. It supplies this maxillary air sinus, and here in the floor or the inferior wall, the interosseous branch of the posterior superior alveolar artery. So these arteries supply this maxillary air sinus. Okay, so the infraorbital artery, posterior superior alveolar artery, anterior superior alveolar artery, and the interosseous branch of the posterior superior alveolar artery and the middle superior alveolar artery. So these arteries supply the maxillary air sinus. So coming to the nerve supply. So the nerve supply of this maxillary air sinus is by the infraorbital nerve, which is in the roof, which is related to the roof of the maxillary air sinus, which is related to the roof, and this posterior wall is innervated by this posterior superior alveolar nerve, and anterior wall by this anterior superior alveolar, middle superior alveolar. So all these innervate this maxillary air sinus. Okay, so infraorbital nerve, so posterior superior alveolar nerve, middle superior alveolar nerve, and anterior superior alveolar nerve. So these are the nerves which innervate this maxillary air sinus. So coming to the important thing here is this X-ray. This you call it as Waters view or occipitomental view. So how does this differ from the ordinary X-rays? Yes, this X-ray, you ask the patient to open the mouth. See, the mouth is open here. See, the mouth is open here. So ask the patient to open the mouth, and then you take the X-ray. So you can visualize all the air sinuses. So this sinus, which is visible here, is the sphenoidal air sinus. Okay, sphenoidal air sinus. So and this is the frontal, and this is ethmoidal. This is frontal, this is ethmoidal, and here you see the maxillary air sinus. I think this you have this X-ray for your Viva. Yes, so this is a occipitomental view or Waters view, in which the patient is asked to open the mouth and the X-ray is taken in order to visualize all the paranasal air sinuses. Yes, sphenoidal, frontal, ethmoid, and maxillary air sinus. So this view we call it as Waters view or occipitomental view. Okay, so coming to the next thing, that is the osteomeatal complex. So what is this osteomeatal complex? It's nothing but the area and the lateral nasal wall, so around the middle meatus, so that receives drainage from the anterior and middle ethmoidal, frontal, and the maxillary sinus. So where all the sinuses drain into the middle meatus. Okay, the osteomeatal complex is nothing but the area on the lateral wall of nasal cavity around the middle meatus, so that receives drainage from the anterior ethmoidal, middle ethmoidal, frontal sinus, and the maxillary air sinus. So this area, which is marked green, is the osteomeatal complex. Yes, you can. This is the coronal section. It's a line diagram of the paranasal air sinus, where you can see all the sinuses. So this is the frontal air sinus, and this is the frontonasal duct. So opening of the frontonasal duct, and this is the maxillary air sinus, which opens into the middle meatus, and this is the bulla ethmodalis. Yes, bulla ethmodalis, where the middle ethmoidal air sinus opens, and this bulla ethmodalis elevation in the middle meatus, that is produced by this air sinus itself. Okay, so that is the osteomeatal complex that is marked there. That is nothing but the part of the lateral wall of the nasal cavity that is related to the middle meatus, where all these these 4 paranasal air sinuses drain into. Okay. So this is another picture. Sorry. Okay, so this is another picture to show you this osteomeatal complex. Yes, so this is the thing that is crossed, that is line marked there, is this area is the osteomeatal complex. So osteomeatal complex is the part in the lateral wall of the nasal cavity that is situated in the middle meatus, where these 4 sinuses drain into. Okay. And then this is again the sagittal section of sagittal section CT picture to show you the air sinuses. Yes, so these sinuses usually appear translucent as they are filled with air. They appear translucent both in X-ray and in the CT. Okay, so this is the frontal air sinus. So you can see the frontonasal duct clearly. Yes, so it is marked here as frontal recess. Yes, so this is the frontonasal duct there. Okay, so this is the sphenoidal air sinus, and here you see the this part is the maxillary air sinus. Okay, so frontal, and these are ethmoidal. Frontal, and this is sphenoidal air sinus. So this is a sagittal section of the CT head and neck to show the paranasal air sinuses. So and one more section you have, that is the coronal section. Yes, so this is the coronal section. You can visualize all the this is also a CT picture. You can visualize all the paranasal air sinus. Yes, you can see the frontal, ethmoidal, and the maxillary sinus. So this is maxillary air sinus, and then this is the frontal, and then this is the ethmoidal air sinus. So this is sphenoidal is difficult to see in this view. So for in sagittal section you can better visualize the sphenoidal air sinus. So the coronal section you can visualize the frontal, ethmoidal, and the maxillary air sinus. So coming to the clinical anatomy of this paranasal air sinuses. So the infection or inflammation of this paranasal air sinus, you call it as sinusitis. And this maxillary air sinus is more prone for infection, since it has to drain against the gravity into the middle meatus. So maxillary sinus is more prone to infection. Yes. So and this is the latest surgery, that is the balloon sinuplasty, which can relieve the pain in the sinusitis, where the endoscopic catheter is passed via this to clear the blockage. So similar to that it's angioplasty of coronary heart disease. Yes, so see, the balloon is introduced, and then it's inflated, and then released, and then it's deflated, and this drainage of this fluid is facilitated by this balloon catheter, which is introduced into the inflamed or infected sinus. So that is a recent thing we use for this, treating the headache or pain in the frontal air sinus, or you can use for the maxillary air sinus also. And another important point which I already told is the transplenoidal approach for the removal of the pituitary tumors or pituitary pathologies. Okay, and the last thing is about the maxillary sinus carcinoma. Yes, so the maxillary sinus is prone for the carcinoma, that is the squamous cell carcinoma. See, you can this is also the CT picture where you can appreciate this. So this is the normal sinus. Yes, you can see a mass that is occupying the whole of the maxillary air sinus and invading adjacent structures also. So this is a maxillary sinus carcinoma. So that's about the paranasal air sinuses. We will see the short recap of what we have read from the beginning. Yes. So the paranasal air sinuses are situated in the around the nasal cavity, and it is named according to the situation of the bone. Okay, where it is. So these are alveolar spaces inside the skull bones related to the nasal cavity, and you have 4 pairs, that is a frontal, ethmoidal, sphenoidal and maxillary air sinus. And the function of these air sinuses is mainly it humidifies and warms the inspired air. It adds resonance to the voice and reduces the weight of the skull. And we learnt about the frontal sinus, where it is situated. It is situated between the inner and outer tables of the frontal bone. And you have the boundaries. It has anterior wall, posterior wall and inferior wall. And the nerve supply is the supraorbital nerve. And the headache produced by this inflammation of frontal sinus is called it as office headache. So this is the anterior wall of this is CT, sagittal section of the CT to show the sinuses. So this is the anterior wall, this is the posterior wall, and this is the inferior wall, which is formed by the roof of the orbit. Anterior is by skin of the forehead, and posterior is related to the frontal lobe. Okay. And this is the drainage. This is the CT, coronal section of the head and neck, to show the paranasal air sinuses, and the arrow mark shows the frontonasal duct through which the frontal sinus drains into the infundibulum of the middle meatus. So coming to the ethmoidal air sinus, it is situated in the labyrinth of the ethmoid bone. Its boundaries are roof and the lateral wall. The roof is formed by the meninges, and the lateral wall is formed by the lamina papyracea, which is a thin paper-like thin bone which situated in the skull. And you have 3 groups of ethmoidal cells. They are anterior, middle and posterior. So they drain at the different sides. The nerve supplies by the ethmoidal nerves, which are branches of the ciliary, and the orbital branches of the maxillary nerve to supply this. Okay, so this is a 3D line diagram to show the situation of the different sinuses in relation to the nasal cavity. And this is a CT coronal section where you can visualize the almost all the sinuses except the sphenoidal air sinus. So you can very well appreciate the crista galli too there. And then the opening of the air sinuses into the lateral wall of the nasal cavity. So the infundibulum, the frontal air sinus drains into the infundibulum, and just below that you have the image of the anterior ethmoidal air cells. Middle ethmoidal air cells drain into bulla ethmoidalis, and the maxillary air sinus opens into the middle meatus just below the bulla ethmoidalis, whereas the sphenoidal air sinus opens into sphenoethmoidal recess. The posterior ethmoidal air cells opens into the superior meatus. So these are the openings of or drainage of the paranasal air sinuses into the lateral wall of the nasal cavity. So when we read about the sphenoidal air sinus, so it is situated in the body of the sphenoid, The anterior part of the roof is formed by the related to optic chiasma. The posterior part of the roof is related to pituitary gland. So this important relation of the sphenoidal air sinus to the pituitary gland is helpful clinically to approach the pituitary gland via the transsphenoidal approach. And the lateral wall of sphenoidal sinus, you have the relation of cavernous sinus, internal carotid artery, oculomotor, trochlea, abducent, and all the three divisions of the trigeminal nerve. So this picture section, this coronal section at that level of will show you the relations of this sphenoidal air sinus to the cavernous sinus and the pituitary gland. And it is innervated by posterior ethmoidal nerves and orbital branch of the maxillary nerve. So the maxillary sinus, which is the largest of the paranasal air sinus, which is situated in the body of the maxilla, it is pyramidal in shape with the base directed towards the lateral wall of the nasal cavity and apex pointing towards the zygomatic bone. The other name for this is the antrum of Highmore. And the boundaries are, so this is a base. Base is related to lateral wall of the nasal cavity and apex towards the zygomatic bone. And you have the boundaries of this maxillary air sinus. You have anterior wall, which is formed by the maxilla, superior wall or roof, which is formed by the roof of the floor of the orbit. The inferior wall or floor is formed by the alveolar and the palatine process of maxilla. And then this posterior wall is related to pterygopalatine and the infratemporal fossa. The lateral wall is related to the zygomatic bone. The medial wall is related to the lateral wall of the nasal cavity. So these are the boundaries of maxillary air sinus. So the blood supply is by the infraorbital artery. All the branches of the maxillary artery supplies this maxillary air sinus. So at the infraorbital, posterior superior alveolar, anterior superior alveolar, and the middle superior alveolar. So all these supply this maxillary air sinus. And the nerve supplies the infraorbital nerve, which is related to the roof of the maxillary air sinus. And you have the posterior superior alveolar nerve, middle superior alveolar, and anterior superior alveolar. So all these which are divisions from the maxillary division of the trigeminal nerve supply this maxillary air sinus. And this important X-ray you have in your viva, that is a Waters view or occipitomental view, which is the plain X-ray, which is taken with the patient mouth wide open. So you can visualize the sphenoidal air sinus via the mouth, and you can visualize all the sinuses in this view. And about the osteomeatal complex, it's an area on the lateral wall of the nasal cavity around the middle meatus that receives drainage from anterior middle ethmoidal air cells, frontal sinus, and the maxillary air sinus. So this picture will give you the location of this osteomeatal complex. So since the maxillary air sinus has to drain against the gravity, it's more prone for infection, and the frontal, and if any infection in the frontal sinus, the infection tend to spread to maxillary sinus easier because of its location, and since it has to drain against the gravity, it is prone for infection. And this is a picture to show another osteomeatal complex, and this is the sagittal section of the CT to show the head and neck, to show this paranasal air sinuses, which appear as the translucent areas. Since it is filled with air, it appears translucent or black in that. And the recent treatment for this is the balloon sinuplasty, which relieves the pain in the sinusitis, where a balloon is inserted, then inflated, and then it is deflated so that the fluid collected here easily drain and the patient is relieved of infection. And about the maxillary sinus carcinoma, so the maxillary sinus is prone for malignancy. Okay, thank you.